common question I have in women is if they are going to get hemorrhoids during pregnancy and after delivery. Hemorrhoids are, unfortunately, a common problem. If I take 100 women, a good 30 of them will have hemorrhoids, and they will end up having them at any point in their pregnancy, but mostly at the end in the third trimester, the last 6 weeks. What can happen with pushing in labor is those hemorrhoids that you currently have become more prominent, much more swollen. And it takes time, even sometimes months, for some of those hemorrhoids to regress and get smaller after delivery. And for some women, they persist forever until they're treated. And treatment of those are really dependent on symptoms that are bad after delivery. If you're bleeding from them, if they're painful, if they create multiple treatments to the emergency room, if the pain is so bad and there's blood clots that's actually found in them called thrombotic hemorrhoids. For most women, it's unavoidable, especially if you're carrying a lot of weight in the pelvic floor, and if that weight from baby is creating all the pressure on those blood vessels that feed the rectal tissue that makes them. Women who have hemorrhoids can use creams mostly for recovery of pain. They're not going to cause a considerable amount of regression of size of the hemorrhoids. So Preparation H, which has a little bit of steroid in it, is used topically to help relieve the pain. But the swelling is really about the blood vessels that feed those hemorrhoids. So you have to really effectively get the cream higher up to reduce inflammation, and that's what the suppositories are for. A lot of women think that you can just place the cream on and then they're going to go away. But that's not the case with those creams. There also are medicated pads, again, mostly for soothing and for relief, and to help with just the discomfort. Epsom salts are a great way to reduce the discomfort, so low-level water baths where a woman can sit and bathe, that can reduce a little bit of the swelling, but mostly it's for discomfort.